Life is complex, so is our mental health. It cannot be understood by diagnosis alone. Our philosophy is treat the person, not the mental illness. Hello everyone, and welcome to another episode of Humanizing Mental Health. I, of course, am Trent Akers.
And I'm Jeremy Alcorn.
Yeah. Well, I feel a whole bunch of parts coming on today, man. What about yourself?
It's time to pick apart.
Yeah. Well, I thought, it's good that we kind of got some of our cheesy metaphors out of the way, because we're actually going to be talking about one of my favorite subjects. Mm-hmm. For those of you that have been listening along quite frequently, you'll notice that one theory that I bring up quite frequently is internal family systems, created by Richard Schwartz back in the 1980s. And no, I like, for those Spaceball fans, it's not the Schwartz, or maybe he enjoys that. And this was a theory that was developed when he was basically an intern and working with a lot of people with eating disorders. And he would get up in the middle, or a lot of these people back in the day that were in the hospital, he would get up with them in the middle of the night, or frequently, like, they would get up as he was an intern, and he would start talking to them, and they would mention about, different parts of themselves, like a hungry part, or a different thing, or parts that were trying to control things, and other parts that had urges. And Richard was trained initially as a family therapist, so he kind of used that family therapy lens to start to build an understanding of literally the internal family. And an analogy that I use for that a lot of times when I'm talking to clients, just to kind of give you all a bit of an understanding, is Inside Out, which is actually one of my favorite movies.
Mm-hmm. Yeah. Sure. Yeah. Go with that a little bit.
So we all have different types of parts where it's we'll basically have we have manager, firefighters, and exiles are our three main parts, and those are just basic categories. And then we can also have our capital P person. Now, the capital P person, is sort of like the as you go, or at the end of Inside Out, it's kind of where they all sort of come together, and it's this idea that you're calm, cool, collected, centered, and the internal ecology kind of works together. And with these other parts, they have different roles. And like, if you kind of think of with anger, or with sadness, or disgust, back with Inside Out, they all kind of had different roles, and they would take over at different times. And with internal family systems, it's kind of about figuring out, when are our different parts taking over, and really what roles do they have, and how can we bring the family back into balance?
Yeah, that sounds really good. Like, I think when someone hears the name of this methodology,
mm-hmm.
internal family systems, I think actually they find it confusing.
Mm-hmm.
And you describing that, it's like, oh, well, this is actually a family therapist that saw that, wait a minute, it seems like inside a person, there's these dynamics that happen that are similar to what happens within the context of a family.
Mm-hmm.
And so he's going, oh, so there's like this internal relationship that we have with the different parts of ourself.
Exactly. Yeah. Like, do you ever find that you're fighting with yourself?
Do I ever?
Yeah. Or sometimes too, like where like I or I'll like a lot of times like with my clients, like they'll say a part of me wants to do this and a part of me wants to do that,
Yeah.
and that's where it's kind of like figuring, okay, well, tell me a little bit more about that part and like what it wants and what it doesn't want, and
Mm-hmm.
then it's about figuring out, like how a lot of times with internal family systems, we find out very much that those parts came around like they were created at a very specific time for a very specific purpose, and because of that, they are kind of locked in amber with viewing you a certain way.
Right. Yeah. And then when something happens in your life, that part comes out
Mm-hmm.
to either protect or guide, yet it actually might not be what you need. That part might actually not be serving you well in that moment anymore.
Yeah, yeah. And I want to highlight the fact, and I say this with a lot of my clients, is that, we have to look at like what are the positive aspects of that part and how can we help it orientate to what's going on right now and find a way, find a new job for it to do to use those skills.
Sure. Yeah. We're not talking about saying that we want to banish anything,
Mm-mm.
but we do want it to fit together in a way that is going to allow you to be healthy.
Yeah, absolutely. And sometimes parts can even be there to protect other parts, especially exiles. For those of our listeners that have ever uh, watched the Doom Patrol show, which is actually one of my favorite shows because of how it actually represents internal family systems. Really, for me, with the character of Crazy Jane, which I know you haven't watched the show. So, Crazy Jane is this character who has multiple personalities, and each of the individual personalities has superpowers. And what we find out is that as a child, when she was born, that she had a very abusive father, and these different personalities sort of developed to protect that child part of herself. And so different parts will come out, and there will be like one primary that will key the actual main, well, the child personality has kind of elected to speak for her. Yeah, well, yeah. I'm sorry.
No, that's fascinating.
Yeah, no, and you're kind of looking at me, and I'm used to you like popping in there with stuff, and I just want to highlight that when we're talking about internal family systems and parts and stuff like that, that dissociative identity can be linked with that, but at the same time too, though with dissociative identity, those are usually parts that have been so dysregulated that they've needed to come out and to take more of a forceful action
Sure.
for protection
Yeah.
for the individual.
Like the individual that has a dissociative identity disorder, which is very rare, that individual doesn't really have that center P.
No.
Like they don't have that center person that is the middle of the spider's web, as it were, that is linked to all of them. And when we're talking about people that are having issues, and we're talking about experiences that have developed particular kind of parts, really what we're talking about to a certain degree is trauma. We're talking about this individual is splitting apart, and that these different parts actually need to be collected back together to fit as a whole.
Yeah, and one way to do that is for the individual to talk to the parts, and like where I mentioned some questions already. Like it's like the individual can orientate to them and sort of ask them what's going on. One thing that I use with a lot of clients sometimes is going into the Gestalt therapy, where I've actually done the old empty chair technique with them, like where they go back and forth. Or another way to do it too, which I've only seen it done. I haven't done it myself. Where they talk about direct access, where the client embodies the part, and the therapist sort of asks the part questions.
Yeah.
And that can be helpful for people, but it's really better for the client to learn to have that internal conversation and to have that patience to embody that capital P person.
Yeah, for sure. In fact, as we discuss this, then I got a question for you. You mentioned 3 major categories.
Mm-hmm.
So can you tell me, the first category I believe that you mentioned was exile. So what does that mean? What is the parts that are exiled?
So exiles are kind of what they sound like. They're parts of ourselves at a certain age, or something that emotions, ideas that we really have either internalized, that we've been told that are bad, or that we try to push away or really protect because we're worried about them getting injured. And so I mean, it could be like a sense of vulnerability or inferiority. It could be, like you mentioned, like a very young, traumatized part. And even though like they're exiles, like sometimes when people act out in a certain way or where they act very vulnerable, that could be the exile coming to the forefront and acting from that very hurt, very vulnerable part.
I gotcha.
Yeah.
And sometimes I wonder, sometimes those exiles, are they things that we don't like about ourselves?
Mm-hmm. Yeah. Oh, yeah. Like there can be a lot of shame or guilt around those exiles, and too, like the exiles and other parts can even come together where they're blended. So it's almost like a symbiote. Like, and I've even used that analogy with like where like if you think about with Spider-Man, right? Like when Spider-Man had Venom,
Yep.
Like he always talked about him and Venom.
And it also pushed a specific portion of personality out more strongly. Sure.
Yeah.
So we talk about exiles, and those being those parts that are pushed away either to be protected or because we don't want them.
Yeah, shame and guilt.
Yeah. Then what about the manager parts? You talk about managers.
So managers are kind of like those parts that kind of come to be able to take control of a situation, to keep it in a certain way. It can be like very organized, or if you have like a part of you that's like when you're on vacation and it's like the manager is like, no, this boom, 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 this needs to happen. Like they're trying to keep the situation or the individual under control.
So in terms of how that plays out in someone's life, a general example of what you would notice that would go, oh, I believe a manager is in the room right now, or that is in control.
Yeah, like when I'm thinking about it, is almost like a mother with kids, where she's like, trains got to run on time, kids got to get out the door, or if you're and because even parts can be activated at certain times, like if you go to work and you're very organized and very on the job and like needing to feel that sense of control and perfection, that could be a manager right there.
I see. So like someone maybe is experiencing a level of distress, and the way that they handle it is by working more. Because in that work environment, they feel good. They feel under control. They feel like they have things together.
But also too, sometimes people, like when they're in distress, they can also have firefighters come out.
Right.
And what firefighters are is that when you're under distress, they could be you engage in certain behaviors as a way to deal with those feelings,
Sure.
and to sort of like mollify how you're feeling, like douse the blaze.
Yeah.
So for me, like when I'm dealing with a lot of people, like let's say if you have addiction issues or
Mhm.
something of that nature, and you're like, the minute that you go and you grab something, like you grab a drink, you maybe grab food, or maybe you're going for video games, that's your firefighter coming out and saying, you know what, this is too heavy, I can't deal with this, I'm going over there to do this.
Right. Yeah. And in fact, that was the other thing I was going to ask, because that's the
Mhm.
last category, right?
Yeah.
So the firefighter often could be something like that. What's the word I'm looking for? It could be addiction. Like it
Mhm.
could be behaviors such as overeating or controlling your food, or a variety of things, but is often comes out in some kind of behavior
Mhm.
that very powerfully tries to shut down what you're experiencing.
Mhm. Mhm. Yeah, and the thing is that managers and firefighters, or all the like I said before too, sometimes they can be blended together. So like what it comes down to, part of the job is to first of all identify, what parts are there, like what parts are sort of in the internal ecology even before you access it, and then recognizing eventually down the road is that when are these parts blended together and kind of helping to tease them apart. We got to pull the symbiote off of Spider-Man,
Yeah.
because we don't want him to be like Eddie Brock or like Cletus Cassidy,
Mm-hmm.
where it's like we, or even worse, I, because you don't know where one begins and the other
Sure.
ends.
And the fascinating thing is we pull it apart first
Mm-hmm.
so that we can put it back together.
Yeah.
It's like a puzzle that needs to fit together in a certain way.
Yeah.
And it's like it's jumbled, or some of the pieces are trying to be forced together rather than actually being whole.
Mm-hmm. Well, and if you think about I think I've already said this. Like these parts mean well. They want to be there. They want to help you succeed. And at one point, having that firefighter in control or protecting that exile, that was important, because that helped you to survive. But now, like if you're in a stable environment, or if you're older and you got more internal
Yeah.
resources,
Right.
let's recognize that. Let's help these parts find a new job so that they can be happy and healthy.
Right.
And you can too.
And it's like you're not a 5-year-old kid anymore, Jeremy.
Mhm.
So you actually can face this because you have more resources, more ability,
Mhm.
and you don't have to exile that anymore. You can let that exile start to come out, and you can deal with whatever that means. If it's guilt, if it's shame, if it's some sort of fear and
Mhm.
anxiety, you can deal with it now.
Absolutely.
You don't need to be saved from it anymore.
Yeah, absolutely. And you can be that capital P person. You can be that parent, that strong older person for this exile.
Mm-hmm. Yeah, for sure. It totally makes sense. And so is this something that for yourself you find that you very often are using as a framework in the background while you're working with people?
Oh yeah, like you know what, Richard said this, and it's so true. Once you start seeing people in parts, you can't stop. You can't stop. Like and like the thing is that I'll tell people right away, like that's how I see them, is kind of in parts, and and a part of what it is you go with the client's language, but I've had so many of them say, well, a part of me feels like this and a part of me feels like that. It's like, okay, hang on,
Sure.
let's bring that part into the room here. Let's sit
Yeah.
it down. Let's have a conversation with that part.
Because I remember when we were doing some supervision practice ourselves, that there was like a level of awkwardness just in our own experience in trying to integrate some of it. And it made me wonder about how much does someone need some amount of like explanation of like, this is what the therapy that we're looking at is going to look like? Because sometimes then it seems like people would just get like confused or not understand what you're trying to accomplish.
Well, and I mean, there again, too, like you can use that theory in the background, but use the client's language. So, like,
Yeah.
I have like one client where she talks about, like, her anxious brain and different things like that. So we use
Sure.
that and we talk about that.
So when somebody starts to kind of talk about this from their own kind of position, in which they start to use this language about, well, there's a part of me that, then immediately you're able to go, oh, let's understand that part more.
Yeah.
Are there actually any other parts? What do they like? What
Yeah.
do they, what do they think? What do they feel?
Yeah. Yeah. And two, it's kind of like, now, did that part come from you or did that part come from somebody else? Yeah.
Do you have any idea where this developed?
Yeah.
And how it came to be a part of who you are?
Yeah. And because we talk about burdens, like there's two different types of burdens. There's the burdens that we develop on our own, and then there's legacy burdens, which is kind of like trauma, or
like an intergenerational.
Thank you, intergenerational trauma. And you have to ask yourself, how much of this is mine? How much of this is somebody else's? And can I put some of this legacy burden down? And what would that feel like?
Yeah, for sure. And what does it mean to be different? Because if it was a legacy burden to me, then I'm 46 years old. So how much of that did I pass on? And what does it mean then to take responsibility for that, even though it wasn't my fault that I got this burden to begin with? Whatever actions that I had in that process, hurt somebody else, well, then I can't actually exile that.
Yeah. So what do you want to do with that part, man?
Yeah. It's a good question, because then I think the big picture is, if I don't exile that shame or guilt, then what is it actually trying to do for me?
What is it trying to teach you?
Yeah, and maybe that is attempting to set new boundaries, like inside myself, about how I would conduct myself and how that would relate to the way it affects other people. And I think that becomes the big part of recovery, right? That is like, even the painful parts aren't bad. Yeah.
Like Dr. Edith Eger in her book, or in her books. For those of you that ever get a chance, check out some of her books. I think one of them is called The Key, and she talks about, because she's a World War II survivor of Nazi Germany, of the concentration camps, and she calls her pain like her beloved pain, her cherished pain, where she's like moved from seeing it as something that she wants to exile to something that's made her who she is, that she can draw positive strength from.
Yeah, for sure. But that can only happen if you face it.
And you embrace it.
Yeah. And you can't then exile it. So that means that part of the therapy, at least what I'm hearing from you, is understanding what are the managers, what are the firefighters, what are the exiles, and being able to peel away in the therapy room the need to manage, the need to firefight, and allowing the exile to be able to come forward in a way that you can start to work with it and work with the other parts to actually properly support that exile rather than trying to get it to shut up.
Absolutely. And you know, like part, like, and I love what you said there, because part of what we can do too is like if somebody's feeling something, we can ask the other parts to please step back. Like, you know, and it takes a level of patience for us to be able to sit there with that, and to, if it doesn't want to come out, it's really like dealing with a scared puppy or a scared child, and it's like, I'm gonna be here as long as you need me to be here. I'm gonna sit here and wait for you.
Yeah, and I'm not gonna make you come out.
No.
But I'm gonna open up the space for it to be possible.
Mm-hmm.
And sometimes that means that I've got to help you to be able to let that space happen yourself,
Mm-hmm.
to let the other things that are trying to manage or firefight peel back.
Yeah. And I just want to say too that normally in the therapy, you don't start with the exiles. You start with the managers. You start with the firefighters.
And tell us about how that works.
Yeah. So so with that, yeah, a lot of it comes down to basically the steps of the therapy are, first, we need to kind of understand like where everybody is at, who's all in the internal family. You know, like everybody kind of needs to have a place card and, you know, get an understanding of who they are.
In other words, in that individual,
Mm-hmm.
what are the players that are inside you? Yeah. What are the parts inside you?
Yeah. And then two, it's about then like first of all, in engaging with with the managers and the firefighters, and saying, orientating them, saying, you know, like how old do you think I am? Like, what do you think I need? And you know, or what is your job? And if you didn't want to do that job right now, what would you want to do
instead?
Yeah. And how can I help you find, you know, that job?
Fascinating. It seems like there needs to be like a level of readiness for someone to be able to engage into this.
Oh yeah. Yeah. And you know, and I think that of course, like for me, a lot of times I won't just start, like, even though they start talking about parts and pieces, like it'll be about one thing I'll get them to do first is learn down regulation skills so that they can be embodied, they can be in their window of tolerance, know what that is, find their capital P person, and then to like even just writing out a script with like where they find a certain event where something comes up and what are those parts, and writing it out, modulating the discussion, talking about what that means, and then bringing that in. We break that down, and then eventually then you start having access. But that's like a while, but it also depends upon where they're at. Some people come in, you know, they may have read the book that I often recommend, and then they're like, okay, I'm ready.
Yeah, for sure. And I guess other people that come in, they're not even sure. They just know that their life isn't the way that they want it to be.
Mm-hmm.
They don't know like exactly what that looks like to move forward. Or they may have any number of kind of ideas about why they're here, what they want to work on.
Mm-hmm.
And so it's always one of those things that it's like, this is a really great model. It could be super effective when applied into the, well, probably anyone could benefit from it, but it would be more about where are they at and what they are wanting to engage in, and what, I guess, their theory of change is. And does this match up with their theory of change?
Absolutely. And it's really helpful for kids too, because they can draw their parts and they can talk about their positive parts too that they want to carry with them. So like maybe it's a knight, or maybe it's a superhero, or maybe it's their favorite baseball star, you know, or, you know, like they have like an internal basketball team.
Yeah, that's super cool.
Yeah. Awesome. Yeah. So, I have talked a lot today.
Yeah, no, this is great. This is great. I think that we kind of really put flesh on the bones of this conversation, And if individuals are interested in being able to have that deeper, attuned or aligned experience inside themselves, then it sounds like this is a really good model to use, and that you would be a great guide in helping them do that.
Absolutely. And if they're interested in this, what I would say, like I can be a guide, or if you're already seeing a therapist and you're interested about this, a book that I use a lot with my clients to guide my therapy, that you may want, if you're currently seeing a therapist, that you might want to talk about with them. It's Self-Therapy by Jay Early.
Oh, perfect.
Yeah. Is there any, what did you kind of take away from today's discussion, man?
Yeah, well, I couldn't help but reflect on myself, my own journey, clearly as you were describing things, and just think about how much I'm lined up with myself, and how much maybe growth is possible there as I can work with the managers and the firefighters in my own life, and begin to see how they can play a different role, and how I could let some of the vulnerable things out in a way that allows me to be more whole myself.
Absolutely. And you know what? That's a journey for all of us. Even though we may think we have everything under control, there's, every once in a while we just need to help the family come back together.
The internal family.
The internal family. Yeah. But yeah, and I really appreciate being able to share this with you, share this with our audience. And I hope that this has been helpful for some people, and it's, making me think about what parts of me are coming out when I'm on the air with you.
Yeah, for sure.
Absolutely. But on that note, I'm Trent Nakers.
And I'm Jeremy Alcorn.
See you next time.
Thank you for joining us today. We hope that this message has been as meaningful to you as it has been to us. If you're looking for help, you can find us on Facebook at Humanizing Mental Health.